What is the best piece of advice that you would pass on for new professionals entering the field?
Well, if I was entering the field, I could say that in my own terms, knowing what I know now, is I would like to really immerse myself in the understanding of the different approaches that are used, and also not only the approaches, the theories, and also the technology that is used. And eventually, I would hope that the person would arrive at the following conclusion, that there is a roadmap, and you need this roadmap, which we call the conceptualization of the disorder. And the roadmap will be the guide to your applying whatever strategies and techniques are indicated. Now, when you see the patient, you first think, if it's PTSD, you think in terms of the symptoms, and you also think in terms of one key word, which is catastrophizing. Okay. So that is part of the roadmap. So you have a general map, general design, and then you apply it to the individual problems. And then each case has to have its own formulation, based first on the patient's history and so on, and then on the application of this map. Then the map then not only is a guide to the formulation of the case, but it's also a guide to what technique you use. So sometimes I'm asked, what do I think of ACT and DBT and IPT and CBT? I said, well, it's good probably to have some degree of expertise in all of these, because what works, a technique that will work with one patient may not work with the other. And depending upon your formulation of the case and your understanding of the patient's strengths and sensitivities, you then will select whatever method is going to be appropriate. Now, we do